Hello and welcome to this episode of Health and You. I am Sumi Sukanya Datta, and today the topic of discussion for us is the latest guideline by the World Health Organization on replacing regular table salt with low sodium salt substitutes or LSSS for normal adults. To discuss what these guidelines mean, why they are important, we have two eminent guests, Dr. Vivekanand Jha and Dr. Navinath M. Dr. Jha is the Executive Director at the George Institute of Global Health in India and also Professor and Chair of Global Kidney Health with Imperial College in London. Dr. Navinath is associated with the Asian Institute of Nephrology and Urology and has previously been with the All India Institute of Medical Sciences. Welcome to the show, Dr. Jha and Dr. Navinath. Dr. Jha, what is the key message in the new WHO guidelines on salt usage and what do they signify?
Thanks, Sumi. Thanks for inviting me uh, to this conversation, and thanks for highlighting this very important topic, which is of huge public health importance, as you said. Now, the background behind this is that the premature death and disability around the world due to cardiovascular diseases, chronic kidney disease is constantly rising. One of the main factors that is leading to this rise is increase in blood pressure and
Mhm.
hardening of blood vessels, uh, for which one of the most significant contributors is the high salt intake. And in the salt, we have the sodium content of the salt that is responsible for this. So eventually, the goal is for us to reduce our sodium intakes. It's important to mention that all populations around the world consume excessive sodium, in fact, more than double of what is recommended by the WHO for optimal health. And therefore, salt reduction or sodium reduction is considered to be one of the most effective public health interventions to reduce the increased cardiovascular disease, chronic kidney disease, risk of preeclampsia, etc. It is also been shown to be something that is not widely practiced. It is very difficult to implement at individual level because people are just used to the taste of salt, right? And
Yeah,
so we
absolutely.
ask, if we ask someone to reduce the salt intake, they don't take very kindly to it. So we have to find a way in which people can actually taste food the same way as they have done until now, but at the same time have low sodium in their salt. And the best way to do this, which has been shown by multiple research studies, including by my colleagues from the George Institute, that if we replace the normal sodium chloride containing salt with a mixture of sodium chloride and potassium chloride containing salt, we can allow people to consume less sodium while maintaining the same taste of salt. The other added benefit of this is that we also increase the potassium content in our diet, and high potassium is good for cardiovascular health. So, in a way, we kill two birds with one stone. If we
Mhm.
do this at a population level by replacing our normal table salt with this high potassium, low sodium salt, then we will be able to achieve this goal. So, and that is what is the message of the WHO. This is
Right.
really important to emphasize this because we have, or the WHO has a goal of reducing the cardiovascular mortality by 30% by 2030. And we need to really take all effective public health measures to reach this goal. It is
Yeah.
very important in India as well. There are very large number of cardiovascular deaths in India. Treatment of cardiovascular disease is very expensive. Treatment of advanced kidney disease is very expensive. And therefore, we must do all that we can to both reduce the burden of disease, but also to reduce the cost of treatment.
Very important message there. But having said that, we would also, and our viewers particularly, would benefit from knowing whether high potassium, low sodium salt can also have some problem, some concerns, and if yes, what is the way to avoid it? So, Dr. Navinath, would you like to chip in here and share your perspective, please?
Yeah, so at the outset, I would like to thank ThePrint for having me on this show. And it's indeed a pleasure to share screen with someone like Professor Jha, who needs no introduction to anyone, any nephrologist, either in the country or the world. So you had introduced Sir, but you forgot to say Sir was also the former president of the International Society of Nephrology. So we
Yeah,
have a very
absolutely.
senior and eminent person with us. So it's indeed a pleasure to share screen with you, Sir. Thanks a lot. So to answer your question, I think Sir had already given a very in detailed introduction to the topic, and so the important thing over here is that to maintain the taste. So whenever we ask the patients to decrease the salt intake, many of them don't follow that because we are not used to a very low salt diet. So in order to maintain salt, we are having to replace sodium chloride with something else, and that something else is usually potassium chloride. So for someone who's having normal renal function, so that would be a vast majority of the population, this replacement usually should not lead to any problem, and it maintains the taste as well. So compliance is better. But there are a very small subset of population, that is some patients who are having renal dysfunction. So we call these patients like the patients with a chronic kidney disease, or certain patients who are on certain medications which prevent the excretion of potassium through the kidney. Now, potassium in the body is predominantly eliminated through the kidneys in the urine. So if there is any damage to the kidneys, or if there's any drug which prevents this excretion of potassium from the body, because the patient is taking an increased amount of potassium, this might accumulate in the body and lead on to hyperkalemia. But this is all theory. So this might be a problem. So we still don't have any scientific evidence to say that these patients should not be on low salt substitutes. So most of the trials which we are talking about, so this WHO guideline is based on multiple trials, but most of these trials have excluded patients who had renal dysfunction or patients who are taking such kind of drugs. So that's why we are, as of now, we cannot recommend low sodium salt substitutes for these patients. But at a general population level, this should not be a problem. But if the patient is having a renal dysfunction, or if the patient is taking these drugs which interfere with potassium restriction, they will have to consult with their doctor before they take such type of substitutes.
Yeah.
Can I just
So,
add one point to this
yes, sir.
response? I think he's exactly right there. But let me also clarify that kidneys are extremely resilient. So until the kidney function really deteriorates to a very low level, the body is able to compensate by increasing the excretory ability of potassium through other routes as well. So the risk of developing hyperkalemia and complications related to hyperkalemia are valid only for those with the most advanced forms of kidney disease, and not really every single individual with kidney disease. So that is a myth that should be dispelled. But again,
Mm-hmm.
the point of testing this formally in clinical trials is important, so that we are able to generate evidence that will reassure the population that low sodium, high potassium salt substitutes are indeed safe in people with early stage kidney disease.
Yeah. So can you also talk about, how practical are these guidelines in the Indian context for people looking to actually mix their salts, if I may use the term? What are the options? Some practical tips that, people can benefit from. Would you like to say something about that, sir? Dr. Jha?
Yeah, sure. So, look, here the action that people can take or should be encouraged to take
Mm-hmm.
should be introduced by the public health authorities. Only then can people really benefit from this, right? The first and foremost is increasing the availability of low sodium salt substitutes. They are not easily available in normal supermarkets. Even when they are available, they are more expensive. So
Okay.
these are the two important things that need to be done. They should be made widely available. They should be made cheaper. Subsidies should be provided for those manufacturers who manufacture and distribute this. And then some other simple public health measures can be taken, which is, for example, increasing its use in schools, in hospitals. That is some, those are a few places where it can be done very easily. In schools, we have the midday meal program, and so in that midday meal program, we can introduce low sodium salt substitutes. We can do so similarly in hospitals also, where people receive food from a common kitchen. It should be encouraged in restaurants, other food outlets, etc., and indeed at home too. By Because the most common or the largest source of salt and sodium in the Indian diet is salt that is added during food and salt that is added on the table. So we need to, by increasing the availability of low sodium salt substitutes, we can encourage people to do that as well. They should be available in the market, supermarkets, where people go and shop for their salt, and it should be available in such, it shouldn't be hidden in some corner, right? It should be displayed prominently so that people can easily see it. And people should then be obviously educated about the benefits of low sodium salt substitute. Now
So
I'd
would
like to
you?
just
Yeah, sorry
Yeah.
about interrupting, but if you could talk a little about the options. Like we have known for a long time that rock salt, for instance, which is used by many in India, is also a low sodium alternative. So can that also be used to probably replace the regular salt that we use to some extent?
Well, that is indeed a myth. The sodium
Okay.
content of rock salt and the common table salt is only marginally different, right?
Okay.
So maybe there is a 5% difference between the common table salt and rock salt in terms of their sodium content. But people often believe that just by substituting normal salt with rock salt, they are able to reduce their sodium intake, and in some instances, even then start adding even more rock salt compared to what they would do if it was to be normal salt. So, indeed, sometimes in rather than the sodium intake going down, it actually goes up. So I don't think that rock salt is at all a kind of common man substitute for.
Yeah, yeah, it's a beneficial substitute for regular salt. Yeah. So, one thing that we have known for a long time is that salt is also a source of iodine in our food now, because, that was started, the fortification started several decades ago, and this is how we get iodine in our food, which is important for conditions like thyroidism. So, if we substitute regular salt as suggested by WHO, won't that be a concern that, how will we then get the iodine that we need regularly in our food? Dr. Navinath, would you like to take that question?
Yeah, so that's really not a very big problem because you can add iodize even your low sodium salt substitute.
Mm-hmm.
So that should really not be a problem. So to just add on to what sir had already said, so this question we asked very often, and I think you had raised the very important question of rock salt or the pink salt, which many of them ask. So most of the patients who come to us, whenever we tell them to go down on the salt, the first immediate thing they ask is that can we go for these type of salts? So, as I think Sir had hit the nail on the head. So, the important thing is that low sodium salt supplement is not the same as rock salt or the pink salt.
Okay.
So, these salts are different from those salts. So, let us not confuse the two. And most of the trials which had used the LSS, which we call the low sodium salt substitutes, they were not the rock salt or the pink salt. So, they are different. So, this is replacement of sodium chloride with potassium chloride. And I tell all my patients that it is about the quantity of salt which is more important than the quality. So there's a wrong conception that the costlier salts, that is especially these pink salts and all those things which are slightly costlier than even the common salt, are actually better. That's not the case. So whenever patients start using these pink salt and all those things, they end up using more of the salt, which at the end of the day becomes counterproductive. So I think that's what sir was trying to explain. So that's very important, and that message needs to go to the public. So even if you're taking the pink salt or the common salt, or even if you're taking the low sodium salt supplement, the amount of salt you take needs to be low. So even if it's going to be a low sodium salt supplement, it's not that you can take how much ever you want.
Mm-hmm.
So
So
that
the
needs to
key
be very,
message,
very
key message
clear.
here is that you have to provide there have to be changes, amendments at the policy level itself in order to make LSSS more available as compared to now, right? This is the key message that we get, and there should be some subsidies introduced, because the available markets, there are some brands which are available in the market, in the supermarkets, but they are very costly, discouraging people from using it. Even those who, one, there is lack of awareness, not many people know that these are available, and also there are costlier options, so people don't go for it, right? This is the key message we get. So towards the end of the chat now, so quick tips from you, because uh, now kidney diseases, apart from cardiovascular diseases, have also emerged as a big public health challenge in India. So quick tips on for people on how to avoid them and how to make their lifestyle better. So we would like to start with Dr. Jha first.
Yes, you are indeed right that kidney diseases, especially chronic kidney disease, have emerged as huge public health threats. In fact, chronic kidney disease right now is the only non-communicable disease with year-on-year increasing death and disability rate, when adjusted for age. All the other conditions like heart failure, coronary artery disease, respiratory disease, they are coming down as far as their rates are concerned. Chronic
Okay.
kidney disease develops most commonly in a background. So, in the background of someone with diabetes, someone with hypertension, people with pre existing cardiovascular diseases, in those individuals who have other family members with kidney disease. So, it's really important that people with all of these risk factors, they get screened from time to time for kidney disease. And these are very simple tests. There is one blood test called serum creatinine test, which and the value can be used to calculate the filtration function of the kidney. And then there is another test called urine protein estimation test, or urine albumin estimation, that allows us to learn more and more about any structural abnormality of the.
So are
So
you
this
saying that people generally, regularly should get these tests done, or should it be done only following an advice from a doctor, or we can get it just done
Yeah,
on a
people with these high risk conditions, especially
okay.
people with these high risk conditions, it's extremely important that all
Mhm.
of them get regularly tested for presence of kidney disease at a regular interval. It doesn't have to be very frequent if there is no kidney disease existing, but if people have early stage kidney disease, then the frequency of that may be a little more. I'd also like to mention here that there are certain parts of India where kidney disease has been seen to develop even in the absence of these pre-existing risk factors. And these are populations in certain geographic areas. For example, in the state of Andhra Pradesh, Telangana, in state of Tamil Nadu, in Goa, in some parts of Madhya Pradesh as well, Madhya Pradesh, Maharashtra, etc. And these are relatively young individuals who are working in agricultural communities, and they develop kidney disease without the presence of any unknown risk factor. So this is a kind of mystery which we are trying to understand more of. So it's important that why I mention this is that it is important that uh, we roll out specific screening programs for kidney disease in these geographic areas where kidney disease might develop even in the absence of pre-existing risk factors.
Yeah, very important views there. Dr. Navinath, quick advice
So,
from you for
so
our
I think
viewers.
the most important point was already said in a very beautiful manner by sir. So the most important thing is early diagnosis, because unfortunately the treatment for advanced stages of kidney disease are all something which the patients really don't want, and they're all quite, let us say, a more complicated form of treatment. So most of the effective or simpler form of treatments are effective only when it's done at the earliest stage of the kidney disease. And unless and until we pick up these patients at an earlier stage, we'll never be able to treat them. So that's why it's very important to pick up early stages of kidney dysfunction, and that can be done only by screening, because early stages of kidney dysfunction does not give the patient any symptoms. So that's where the trouble is. So let us say the patient is having a chest pain or a fever or something like that, they always go to the hospital. But early stages of renal dysfunction does not give the patient any symptoms. Some patients can have mild swelling of their feet and all those things, but everyone need not have that. So the most important thing is, if you are a high risk patient, so whom do we mean by a high risk person? Anyone who's having hypertension or people who are having diabetes need to get their kidneys tested, and if there is any problem, they can be managed accordingly. The second thing is, which we find very commonly is a problem, is self medications. So many patients tend to go for over the counter painkillers, or even trying to take traditional indigenous medicines. So these can also be a bit problematic. So all these things needs to be looked into. And if these patients are picked up early, even progression of kidney failure can be prevented, or at least the pace at which the kidney function worsening happens can be slowed down quite dramatically, so that they don't reach a stage where they need treatments like dialysis or transplant. So the most important thing is this. And for someone who's having no risk factors, how to take care of the kidney, that's very simple. Hydrate yourself well, have a very active lifestyle. Make sure that you don't become obese, or you don't put on too much of weight, and avoid smoking as much as possible. Stopping or avoiding smoking is not only good for your heart but also for your kidneys. And adequate hydration, so that's also very important. So that question we get asked often: so how much water should I drink, doctor? There's no magic number over here. It's just based on your thirst. So you work in a very hot day, you're sweating a lot, you need more water, you're very much more thirsty, you can take more water. It's winter, you're not feeling very thirsty, you need not take too much of water. So the amount of water you take in is also based on the thirst. So this is especially for someone who's normal. So adequate water intake, a healthy lifestyle, and stopping smoking, and getting yourself tested regularly if you're a high risk person. This should be
Yeah,
sufficient to take your
you
diabetes.
you mentioned about obesity, which is a buzzword these days. So obesity is a mother of all non-communicable diseases, including kidney diseases, as we know now. So that's one important thing we should keep in mind. And with that, we come to the end of this discussion, very important discussion. I'm glad both of you could take out time from your busy schedules and join us for this important
Can I
discussion.
make
Thanks, sir. Yeah, yeah, sure, sir. Please go ahead.
Yeah, sure. I'd just like to make one point of very important point, which is related to advocacy. The
Mm-hmm.
global kidney health societies, such as the International Society of Nephrology, the Indian Society of Nephrology, and many other societies, are really working very actively with multilateral organizations such as the WHO and governments around the world to ensure that early detection of kidney disease is included in public health programs, so that
Mm-hmm.
these individuals are picked up in a timely manner, they can receive timely medical care, so that more advanced forms of kidney disease and cardiovascular disease can be prevented. This is
Yeah.
a very important message. We are actually approaching the World Health Assembly, which will happen in the month of May this year, where the government of Guatemala is going to table a resolution for including kidney disease in public health priorities. We are developing a set of best buys for people with kidney disease, how it can be prevented using some very simple steps, etc. So this is something that's a matter of active advocacy throughout the world.
Thank you for sharing that information, and let's hope that kidney diseases also get the importance that they deserve in India's national program for non-communicable diseases. Thank you so much, sir. Thanks, Dr. Jha and Dr. Navinath. Really appreciate. Thanks.
Thank you very much.